Hello everybody, I am Dr. Shipra and today's topic is stem cell. What are stem cells? They are actually battles over the human embryos. These stem cells, they have ability to continuously divide and differentiate into various other kind of cells or tissues. These are actually the biological cells which are found in all the multicellular organisms. These cells are blank and unspecialized or undifferentiated cells. These stem cells have immune potential and can help to treat a wide variety of medical problems. And discovery of these stem cells lead to a whole new branch of medicine that we call as regenerative medicines. John B. Gurdon and Sinya Yamanika got the Nobel Prize in 2012 in physiology or medicine for the discovery that these mature cells, they can be reprogrammed and become pluripotent. Now, where does these stem cells come from? If we see a life story, then it will start with a sperm and ova. They undergo fertilization and then zygote is formed. Zygote, that is pronuclear stage. Then first meiotic division, 2-cell zygote is formed, then 16-cell morula is formed, then blastocyst is formed, and the blastocyst is formed and the baby is formed. Then placenta is formed and then the baby is formed. But if we interfere, or if we see if we stop in the middle, that is at the first week of development, when there is a formation of blastocyst. Here blastocyst stage, that is the outer layer trophoblast and inner cells are, and these cells, they are known as inner cell mass. Now if these inner cell mass, they are cultured outside, or in vitro cultivation has been done of these inner mass cells, and they are provided with a different culture conditions, they will develop into a particular type of cell, whatever condition we have provided them to grow in vitro, right? So there are different type of cells. That is the single cell embryo. When it is formed, it is a totipotent cell. Totipotent cell, that means it can develop into a, totipotent means total, it can develop into a whole organism. When it is 5 to 7 day embryo, then we call it as a embryonic stem cell, because we are taking the inner cell mass, or you can say we are taking the inner cells from the blastocyst stage. That's why we call it as a embryonic stem cells, and these are also known as pluripotent stem cells, right? Then the adult stem cells, that means if we are taking it from the infant or from the adult, then we call them as a multipotent. Multipotent means they are forming multiple type of cells, right? Then cord blood stem cells, placental stem cells, they are also multipotent cells. So these are the stem cell timelines. Totipotent, I have told you, that is total organism is formed. That means total organism means total blastocyst is formed, that is total trophoblast plus inner cell mass. Pluripotent cell means many cells are formed from this inner cell mass. Only the inner cell mass is taken, and it is forming embryonic. This we call it as a embryonic stem cells, and they will develop into many stem cells. Multiple or multipotent, that means it will be forming several organs or several cells, whichever the requirement. Then as we say that these first in vivo fertilized egg, that we call as a totipotent cell, that means it is developed into a complete organism. Then 8-cell embryo, then when it will form a blastocyst, then from blastocyst we are taking the inner cell mass, that is cultured, they are undifferentiated stem cells, then we call it as a pluripotent stem cells. And these pluripotent stem cells, they give rise to several cells like nerve cells, cardiac muscles, blood cell, whatever the condition, whatever the culture medium we provide, they will develop into a particular type of cell. So these adult cell, or you can say pluripotent cells, they are reprogrammed. They can be induced, and when they were induced, they will develop into first of all, three layers will be formed, like mesoderm, middle layer, internal layer, endoderm, and then external layer, that is ectoderm is formed. Ectoderm, that is forming different type of cell. Endoderm is forming different cells like lung cell, thyroid cell, pancreatic cell. Mesoderm, that is a middle layer, it is forming cardiac muscle, skeletal muscle, tubule cell of the kidney, red blood cell, smooth muscles, etc. Right. So we have seen that the stem cells, they can be extracted from the blastocyst stage. That is, we call them as embryonic stem cells. If they are taken from the fetus or from the adult, then we call them as adult stem cells. So there are many locations in a adult body where we get these stem cells. For example, the teeth, brain, skeletal muscles, bone marrow, liver, skin, heart. These all are the places where the stem cells can be found. Then the umbilical cord blood stem cells, they are the adult stem cells of infant origin. They are less invasive than the bone marrow cells. They have greater compatibility, less expansive, obtained from the cord immediately after birth, and they are actually the rich source of hematopoietic stem cells. Hematopoietic stem cells, that means which are forming the blood cells. These are referred to as neonatal stem cells. They are less mature than those they are found in the adult bone marrow. Adult stem cells, they are undifferentiated cells, and they are found among differentiated cells in a tissue or the organ after birth. They do not disappear following the birth. They play an important role in recovery of damaged tissue. The only drawback with these adult stem cells is that there is a decreased reserve of these cells, and they have loss of vitality as increase with the age. These stem cells, they develop into other type of cells also, and mostly recovered by the bone marrow. And the use of adult stem cells in research is also not controversial, because the use of embryonic cell is require the dissection of an embryo, which adult stem cell not. Then bone marrow, or you can say the peripheral blood, they are found in the spongy bone where blood cells are formed. The bone marrow, it is aspirated from the posterior and anterior iliac crest and has traditionally been the source of hematopoietic stem cells for bone marrow transplantation. So it is used to replace damaged or destroyed bone marrow with a healthy bone marrow stem cells. So the hematopoietic stem cells, which circulate in the peripheral blood, they are in the low concentrations. But if we administer certain hematopoietic growth factors like EPO or GSF or GM-CSF, then the concentration of these hematopoietic progenitor cells in the blood increases. Then this cord blood stem cells, they are not useful. They are not just useful for the baby, but also help for the whole family. Right, the siblings, they have 25% chance of being a suitable match. During a stem cell transplants, they are twice as successful when the stem cells come from a family member rather than from a non-relative. So once in a lifetime opportunity for preserving a biological resource, they could be a lifesaver for the child and also for the other family members. So we can say it is a life-saving alternative to the bone marrow transplant, and there is a lower probability of graft versus host disease and a greater likelihood of finding an appropriate tissue type match. The clone ship formed is a best example of these formation of these clone ship is a best example formation from these stem cells, that is dolly. So we can say that the future of reproductive technology क्या कि we know everything about every gene in every embryo. कौन सा जीन रेस्पॉन्सिबल है फीमेल में टॉलनेस के लिए, कौन सा जीन, कितने जीन रिस्पॉन्सिबल है टॉलनेस के लिए, कौन सा जीन एसोसिएटेड है वीकनेस के लिए, कौन से 5 जीन एसोसिएटेड है ADHD के लिए, या 1 जीन एसोसिएटेड है पुअर विजन के लिए, कौन से 3 जीन एसोसिएटेड है बैड टीथ फॉर द मेल्स, 4 gene associated with tallness, 2 gene associated with weakness, 4 gene associated with Alzheimer's, 1 gene associated with poor vision. तो मतलब हमें ये बात पता हो जाएगी कि कौन सा जीन एम्ब्रियो में क्या प्रॉब्लम क्रिएट करने वाला है और उस जीन को हम फिर चेंज कर सकते हैं, राइट, सो दैट दैट डिफेक्ट विल नॉट फॉर्म इन अ baby. So we can say that finally we can form designer babies with the help of these stem cells. Scientists can grow full-size beating human heart from stem cells. Bill Gates contributes to California the stem cell campaign. Obama gives funding for scientifically worthy human stem cell research. Then there are lots of uses of stem cells talked from head to toe, like baldness, blindness, deafness, amyotrophic lateral sclerosis, myocardial infarction, muscular dystrophy, diabetes, stroke, traumatic brain injury, learning defects, Alzheimer's disease, Parkinson's disease, missing teeth, wound healing, bone marrow transplantation, spinal cord injury, osteoarthritis, rheumatoid arthritis, Crohn's disease, multiple site cancer. There is no disease which cannot be cured with the help of these stem cells. For example, there is a stem cell treatment for the hair loss. Now, with the help of this stem cell technology, hairline back with a new stem cell technology, that is, they will stimulate the resident hair stem cells proliferation and differentiation. They regulate the immune system to promote natural hair follicle growth. They will replace the damaged cells by improving blood circulation. Then, how it cures the poor vision, that is, we remove tiny samples of stem cells from a good eye. Then we grow them on the contact lens for 10 days. Then we place this contact lens in a damaged eye for 3 weeks, and we see that these stem cells, they heal the damage to the cornea and sight quickly improves. Missing teeth, these stem cells or dental pulp is taken from the patient. Both adult mesenchymal stem cells and embryonic stem cells can be used. They can be cultured in the lab into a tooth bud. Then they implant tooth bud in the gum, which fuses with the jawbone, and it releases chemicals that encourage the nerves and blood vessels to connect with the gum. And as a result, it will give rise to a new tooth or a dentin, which is approximately within 2 months. Now, how they cure the kidney cells? We take the stem cells from embryo, from bone marrow, or from the umbilical cord. They culture these stem cells with a special chemical growth that will increase the growth of the kidney cells, because our requirement is to cure kidney cells. Now then new kidney cells, they now injected into the kidney, and thus they will repair the damaged tissue. Then the embryonic stem cells, they are capable of differentiating into cochlear hair cells in adult inner ear, and thus the deafness problem or hearing loss is cured. Now, how the osteoarthritis can be treated with these stem cells? Small amount of fat, they are siphoned off from around the stomach region. Now the mesenchymal cells, that is a type of stem cells, they are extracted and grown in a laboratory for around 2 weeks. Now these cells, they are injected into knee. They grow into new cartilage, slowing and even stopping tissue from being destroyed. Now the cells, they migrate to the joint lining and they help to halt the inflammation. So this is a way how this stem cells, they are treating the osteoarthritis disease. They are also helpful in jump starting repair of eroded cartilage that we call as rheumatoid arthritis. Crohn's disease, like देखिए, this is a normal one, and here you are seeing the inflammation and ulcer is present in disease, and this we call it as a disease stomach, that is a Crohn's disease. Then they can regenerate spinal cord, heart tissues, and any other major tissues in the body. Then we are saying that these adult bone marrow stem cells, they may be injected into heart and they are believed to improve cardiac functions in victims of heart failure or heart attack. Then they can cure the Parkinson's disease. What is a Parkinson's disease? There are a disorder that results from the loss of a single cell population, that is dopaminergic neurons, which are present in the substantia nigra. This suggests that this cell, the replacement should be adequate to create it. मतलब जो पार्किंसंस डिजीज होती है उनके अंदर क्या होता है, नॉर्मल न्यूरॉन्स जो होते हैं वो तो डोपामीन सिक्रीट करते हैं, लेकिन पार्किंसंस अफेक्टेड न्यूरॉन जो होते हैं उनके अंदर डोपामीन सिक्रीशन नहीं होता है, तो उनके अंदर मूवमेंट के अंदर डिसऑर्डर्स होते हैं. तो ये जो पार्किंसंस डिजीज है, दैट कैन ऑल्सो बी क्योर्ड विद दीज स्टेम सेल्स. जब हम कुछ सेल्स जो हैं वो रिप्लेस कर देते हैं कि न्यूरॉन्स जो हैं वो अगेन डोपामीन सिक्रीट करना शुरू कर देंगे, राइट. तो दैट मीन्स देयर इज अ क्योर ऑफ पार्किंसंस डिजीज. टाइप 1 डायबिटीज, जिसमें क्या होता है, पैंक्रियाटिक सेल्स जो है वो इंसुलिन प्रोड्यूस नहीं करते, तो ये जो एम्ब्रियोनिक स्टेम सेल्स हैं इनको इस तरह से ट्रेन किया जाता है कि वो क्या बन जाए, पैंक्रियाटिक आइसोलेट सेल्स बन जाएं, जिससे कि वो इंसुलिन को सिक्रीट कर सकें, राइट. तो इनको हम इंजेक्ट कर देते हैं इनटू द पैंक्रियाज, जैसा कि इसमें बता रखा है. पैंक्रियाज के अंदर हम इनको, पैंक्रियाटिक स्टेम सेल्स को हम इसके अंदर डाल देते हैं, जिससे कि दे विल स्टार्ट फॉर्मिंग द इंसुलिन. Then the leukemia patients, they are also treated with stem cells. They emerge free of disease. Injections of stem cells, they reduce pancreatic cancers in some of the patients. There are so many diseases which can be treated by the stem cells. As I have told you, so many cancers like acute leukemia, chronic leukemia. There are so many disorders which can be cured with the help of this stem cells. These are the references and some of the extra sources which I have provided with this video. Thank you for your kind attention.